Hello everyone, and welcome. I'm excited to have you here today. We will be discussing the best treatments for PCOS or PCOD, as suggested by the gynecologists of Paris Hospital. In this presentation, we'll cover various treatment options, insights from experts, and tips to manage this condition effectively. So let's get started and explore how we can support women dealing with PCOS and PCOD. To find out more about PCOS or PCOD, including their effects, causes, and the best treatments, I encourage you to read the detailed post in the Paris Hospital News. A woman's body is quite a complex structure, which is one reason why it reacts adversely when something unexpected happens. Among these responses is the development of polycystic ovarian syndrome, or PCOS, also known as polycystic ovarian disease, PCOD. According to the case study from Paris Hospital, these conditions involve the formation of cysts in the ovaries. As the name suggests, PCOS is a condition where tiny, fluid-filled sacs start growing inside the ovaries. These sacs contain immature eggs that do not mature, which means ovulation doesn't occur as it normally would. When ovulation is disrupted, it impacts the levels of hormones like FSH, LH, estrogen, and progesterone. This hormonal imbalance can then affect the menstrual cycle, causing irregularities or missed periods. Understanding these key points helps us see how PCOS and PCOD are interconnected and why they are significant in women's reproductive health. Let's take a closer look at some common reproductive and hormonal health issues women may face. Starting with infertility, which can be a significant concern for many couples trying to conceive. Fertility itself can be affected by various factors, including hormonal imbalances and physical health conditions. One such condition is male pattern or androgenetic alopecia, which leads to hair loss and thinning on the scalp. Hair loss isn't just limited to the scalp. It can also manifest as abnormal hair growth in areas like the chest, belly, back, and face, which is often linked to hormonal changes. Moving on to menstrual problems, some women experience periods with excessive bleeding, which can be both physically and emotionally draining. Others might have irregular cycles or no periods at all, indicating underlying hormonal or reproductive issues. Skin changes are also common, such as pus-filled acne or darkening and abnormal growth of hair on the chest, belly, back, and face. These symptoms often point to hormonal imbalances. Unexpected weight gain is another frequent concern, and it often correlates with hormonal disruptions affecting metabolism. Now, focusing specifically on PCOS or PCOD, polycystic ovary syndrome or disease, these are considered genetic syndromes, meaning they can run in families. In fact, about 40% of women with this condition have a history from their mother or sister. The key characteristic of PCOS-PCOD is the growth of unusual sacs inside the ovaries, which disrupt normal hormone levels. This hormonal imbalance can cause a range of symptoms, including irregular menstrual cycles, weight gain, infertility, and hair loss. Understanding these symptoms and their connection to hormonal health is crucial because early detection and management can make a significant difference. Remember, while PCOS-PCOD is complex, it's common, and proper medical guidance can help manage these symptoms effectively. When it comes to managing weight, a proper diet plays a crucial role. If you're unsure about what diet to follow, don't worry. Paris Hospital's team of specialized medical professionals can guide you through that process. You can also refer to the Paris Hospital case study to get a clearer understanding of how tailored dietary plans can make a difference. Now let's talk about insulin. When insulin levels are high, they produce more androgens, which can disrupt your hormones and lead to hormonal imbalances. That's why it's so important to keep insulin levels in check. One effective way to do this is by avoiding foods rich in refined carbohydrates, which can spike insulin. According to the expert team at Paris Hospital, combining the right foods with an active lifestyle can significantly improve your condition. Remember, Women facing PCOS or PCOD often have higher than normal insulin levels, which contributes to the hormonal imbalance. And if you're wondering about the importance of diet, don't fall for fake claims or fraud cases. Instead, focus on understanding the symptoms of PCOS or PCOD and how a nourishing, balanced diet can help regulate hormones and address issues related to these conditions. So the big question is, can a change in diet truly affect PCOS or PCOD? The answer is yes. A well-planned diet, along with healthy lifestyle choices, can play a vital role in managing these conditions and improving overall health. When you consult with the gynecologists at Paris Hospital, they will recommend some natural and effective treatments to help manage PCOS or PCOD symptoms. These treatments are often tailored to each individual's needs and focus on balancing hormones and improving overall well-being. Some of the top remedies suggested by our experts include lifestyle modifications like a healthy diet and regular exercise, which can significantly reduce symptoms. They also might recommend specific herbal supplements or natural therapies that support hormonal balance. It's important to remember that these remedies are part of a comprehensive approach, and working closely with your doctor ensures you get personalized advice. Our goal is to help you manage PCOS/PCOD effectively while maintaining a healthy, balanced lifestyle. This aligns with our overall theme of empowering women to take control of their health through expert guidance and natural methods. As per the news from Paris Hospital, it's really important to control the intake of carbohydrates when managing blood sugar levels. Instead of eating more carbs, it's better to focus on foods that are rich in fiber and protein. This helps keep your blood sugar stable and supports overall hormonal balance. Keep an eye on the carbohydrate content in your food and choose options that are free from preservatives and artificial sugars. Some of the best whole foods to include are vegetables, fruits, legumes, and whole grains. These foods not only help in maintaining healthy insulin levels, but also play a key role in managing conditions like PCOS and PCOD. By choosing whole foods, you're supporting your body's natural ability to regulate insulin and reduce symptoms associated with these conditions. So, making mindful food choices is a crucial part of managing your health effectively. To fight and manage symptoms of PCOS, the gynecologists of Paris recommend that women dealing with this condition focus on consuming magnesium-rich foods. Foods like spinach, bananas, almonds, and cashews are great options. These foods not only help boost magnesium levels, but they also play a role in managing insulin levels, which is crucial in PCOS management. Next, when a woman has PCOS, she often experiences increased bleeding during her periods, which can lead to iron deficiency and even anemia. That's why the gynecologists at Paris suggest incorporating iron-rich foods into your diet. Foods such as eggs, broccoli, liver, spinach, and even iron supplements can help replenish iron stores and support overall health. Finally, since PCOS is a chronic inflammatory condition, reducing inflammation through diet is very important. You should consider including anti-inflammatory foods like leafy greens, tomatoes, olive oil, tree nuts, tuna, and mackerel. These choices can help manage inflammation, which is a key aspect of controlling PCOS symptoms and improving overall well-being. Remember, these dietary strategies are part of a comprehensive approach to managing PCOS effectively. Managing PCOS or PCOD effectively really requires a comprehensive approach. It's not just about one thing, but a combination of proper nutrition, regular exercise, and professional medical guidance from experienced gynecologists. The experts at Paris Hospital emphasize the importance of including high-fiber foods in your diet. Think of foods like lima beans, pears, and Brussels sprouts. These help regulate your blood sugar levels and improve overall hormonal balance. At the same time, they recommend avoiding coffee and tea, as these can sometimes exacerbate hormonal imbalances or cause other issues. And of course, cutting back on junk food, fatty, and oily foods is crucial. Instead, Focus on staying active through regular exercise, which supports weight management and overall health. For more detailed guidance, you can read the Para's hospital news or connect directly with their experts, like Dr. Preeti Shukla, who can provide personalized advice. In summary, remember that managing PCOS or PCOD is about a balanced approach, good nutrition, staying active, and seeking professional support when needed. This aligns perfectly with our overall goal of promoting holistic health and well-being.